Hi, we're back with In the Loop. My name is Allison Villars. I'm Director of Health and Human Services at St. Tammany Parish, and today I'm honored to have Lavondra Dobbs, who is with VIAlink211, and she's going to explain what they do, how they do it, and how you might be able to help. Lavondra, tell us a little bit about who you are.
I've served as CEO for VIAlink for the last 3 years. Prior to that, I was the Programs and Services Director. I've worked with the software company here in St. Tammany Parish and served as the Director of the Brain Injury Association for Louisiana. And I am a resident of St. Tammany Parish.
You live in Covington, right?
I live in Covington for the last 24 years.
Cool. Well, so VIAlink is separate from 211.
211 is a program of VIAlink,
Okay.
and VIAlink is a nonprofit.
Okay, so VIAlink has, a great reputation on its own, but 211 is really an important piece of all of what you do. So can you explain for people who've never heard of 211 what 211 is?
Sure. 211 is a number designated by the FCC for Health and Human Services, like 911 is designated for emergencies. So that number's been around since 2001 when it received that designation, and since that time VIAlink has taken the calls from 504 and 985 area codes to provide health and human services information and referral. So, and actually February 11th, 211 is our National 211 Day. So there will be some publicity coming out about that and being pushed out also through the United Ways. But we actually operate 24/7. So if you have someone that maybe they're taking care of an elderly parent or a child with some disabilities and they just need a break, they need respite, they can call us and we can tell them what resources are available in their area or closest to them. We categorize everything by zip code that would be available to help them out. If they're needing to know where the nearest food pantry is that's open, we can provide that, and just that whole gamut of health and human services.
And if they're sort of shy and don't want to call 211, can they figure out resources any other way?
Sure, you can go to our website, vialink.org, and starting in February, you could also text us. The short code would be TXT211 or 898-211, and talk with a counselor that way.
So you have a text program that's been going on for a while with youth.
For crisis, yes.
Crisis. Can you tell us about 211 as it relates to crisis and specifically the youth part?
Sure. So we became a blended center many years ago, and blended is information and referral and crisis work. So all counselors are trained to handle both types of calls. And that was because people calling for information and referral, we found many times were in crisis. Things had gone on so long, they needed an abundance of resources, they needed help prioritizing the order in which to address their needs and those resources, and they needed some follow-up. So we began doing the crisis work, then became part of the National Suicide Prevention Lifeline as a provider to callers from Louisiana for that service. So we collect a lot of demographic information on our callers, and over the last few years noticed that calls from that 12 to 22-year-old demographic were really falling off quite a bit. And we all know that youth, when you call them, really don't answer the phone, but if you text, you'll get a response. So about 3 years ago, we implemented a teen crisis text line. It's a 504 number, 504-777-3283. And the response was pretty dramatic. The year prior to launching that teen text line, we had 54 phone calls from youth in crisis over a 10-parish area. And by the end of that first year, we had had well over 18,000 conversations with youth.
By text?
By text, right.
Whoa, so you have the ability to do text with youth. Is that going to be opened up? It sounded like it would be opened up in some way.
Well, we probably are going to move it and open it up. If somebody texts now that is not 22 and younger, and I think we've had maybe 2 instances of that, and they were like 25. Of course, you know, they were chatted with, but via text. What we find folks older are using is our crisis chat line, which you access through our website, VIAlink211. And once you go there, an icon will pop up. Do you want to chat with a crisis intervention specialist? And that's available 24/7 also. All of our services are 24/7. So, and that's where we're seeing those older than 22 going. It's really good for the working person if they're having a really difficult day. The software that we use does not leave any type of footprint on the device from which they're contacting us from. So it's very safe to use at work and nobody will know that you chatted with a counselor. It's also popular with victims of domestic violence and victims of human trafficking. It's a safe, they're finding it as a safe resource to reach out.
And so the other population, the older population, what do they use?
We're still a lot of phone calls, but you know, we are seeing more and more chats, and we have not started collecting any data yet on our Text 211 as we launched that in February. But I'm anxious to see how many people will text. I know my 91-year-old father is an avid texter and has been for a long time, and that's really kept him close to his grandchildren. As his hearing started to go, the texting was what really kept him connected. So maybe that will happen with more of our elderly too. We do have a very high number, that's of the age demographics in St. Tammany Parish. Right now we're getting more calls from the 60 and older group.
So it's interesting that you have this vibrant organization and you have people working in it, and then you have a board for it.
Right.
How are you funded?
So our funding, so VIAlink has 3 main programs: the 211, the crisis work, and then the homeless management information system. So that homeless management information system is HUD funding for that. Our crisis work and 211 work is a lot of grant writing and some United Way support there too. Our catchment area for 211 actually covers 4 different United Ways, but 7 of those parishes fall under the United Way of Southeast Louisiana that serves St. Tammany Parish. So that's a portion of our funding, and then a lot of grant writing, and then donations.
So how can a person make a donation?
You can always call us and send us a check, or you can go online to our website and make a donation.
So do you have a secure site for that?
We do have a secure site for that.
Okay, and there's a donate button.
Yes.
It's easy to find. Okay. I understand you're changing your website a bit?
Yes, we're going to do some upgrading. We've started on the resource search piece of that, so you'll be seeing some changes as we go through the next few months, kind of taking a piece at a time on the site.
That's great. You're expanding.
Yes.
More resources.
More resources.
So if I went online right now, I think there's a little box that I can put in my what I'm looking for, and then my zip code.
You need to put in your zip code or your parish.
Okay, and then it takes me
and click the box that says search all, not just by taxonomy. So it'll look at all the terms that you've put in there.
Okay, and then I can find something without actually even talking to anybody.
Right.
So I can do it on my own if I'm an independent person and don't really want to talk to somebody else.
Or, you know, you can utilize that chat box that's there too.
All right.
You know, you could just type in, if you're having trouble, just let them know, I'm having trouble finding something. Can you help me? And they can search with you.
Oh, that's great. I didn't know that piece of it. That's amazing. I also read online and have heard you talk a little bit about volunteers. Can you talk to me about how you use volunteers?
We mostly use volunteers in our contact center, so they would be trained in information and referral in crisis. There's about 80 hours of training before they would be working on their own without somebody sitting with them, listening in, and assisting them through the call. But we always have the ability to listen in on a call when somebody new is working or somebody that's been there a long time, as part of our quality control too.
So who would likely be a volunteer? I mean, I can think I was in a counseling program at one time, and it would have helped me learn more about my field.
We do tend to draw a lot of our volunteers from either social workers or counselors. We get a lot of volunteers from UNO, Loyola, and Tulane, so those that have the social work and counseling programs. We have several interns from their graduate programs too. We've had some discussions with Southeastern about using volunteers from there and putting an internship program together, so that's something we're working towards too. But really, anybody that has an interest in it, has empathy, and can pass our interview and written process for, you know, just to kind of see if it's a good fit too.
So when I went online, one of the things I was looking for was children's services. And I clicked on a button that said legal as it related to it. And one of the things that came up was CASA. So this is just an example of what might be online. Can you tell us what CASA is?
So I know CASA's here in St. Tammany, and it is a program for court-appointed volunteers, right, to work with children. I know that they've got a lot of resources here to assist children that are in the court system.
So one of the things I really liked about CASA personally is that what they do is they are the spokesperson just for the child. They're not about the parents or the system that the child might be in if they're in foster care or anything. They are the children's advocate, and there's a lot of training that goes into that volunteer position too.
Right.
So what are we not talking about that we should talk about in terms of 211?
So you should know that 211 is not just here in Louisiana. It's available in 95% of the U.S. So if you are traveling, you find yourself in need or someone with you in need, it's a good number to call. And just some of the impact over the last year nationwide, some of the things that the United Way Worldwide has collected statistics from the 211s that are out there, and there's about 250 operating throughout the nation, that we answered more than 13 million calls last year. This is just phone calls, not the text or the chat. That we comprise, there are about 26 million website visits to our sites. We connected more than 3.9 million people to housing and utility assistance. Those are big requests for us. And there were about 295,000 connections to education resources. Education is a whole a field of resources that we collect too, in addition to basic needs and mental health and general health. And then 1.3 million connections to food assistance. And then 2 million to mental health resources.
That's amazing. Yeah. That's such a great service across the nation. Well, I want to say something about the cold snap we just had, and one of the services that you connect people to. You connect people to housing services and utility services. I don't know about anybody else, but the bill I just got was like 4 times what I normally get, because my pipes did freeze and I wanted to warm them up.
Yeah.
And so people who are sort of in the ALICE population, asset limited, income constrained yet employed, those people might need some assistance, and if they call 211, you could direct them to assistance.
We could tell them who's providing that assistance currently, right?
Yes.
And we do also, in situations like that, as the parishes release their information on shelters for freezing, that we do put out that information too, you know, either by phone, we put it out through our social media sites too, and on our website.
So you've been instrumental in this recent freeze, and we're very thankful for it. And just so you know, Lavandra's 211 service works with our LAHEAP program, which is Low Income Housing Energy Assistance Program, to refer people in need with assistance with their energy bills. So Lavandra Dobbs with 211 and with VIAlink, we're very happy that you came, and we are going to be having a follow-up with Lynette Savoy with the STOPS program, and we'll explain what that is in just a minute.
They told me a bottle couldn't dream, that I would never become a superhero. I learned how to fly. Just to come back in a new disguise and be the hero that I've always wanted to be.
Hi, this is Allison Villars again with the second half of In the Loop. I'm the Director of Health and Human Services, and in this session I have Lynette Savoy, and Lynette is the Executive Director for the STOPS program. So my first question to Lynette is, tell us what STOPS is.
STOPS is St. Tammany Outreach for the Prevention of Suicide.
And how long have you been the Director?
I've been Director for 8 years.
And how long has STOPS been around?
Since 2001.
Tell us what STOPS does.
So STOPS is, it has a threefold mission. The first thing that we do is we do suicide prevention education training. That is a big, one of our big things. We do 2 different trainings. One is called Safe Talk, Suicide Alertness for Everyone. It's a 2.5-hour course. It teaches people to recognize the risk factors and the warning signs of someone who could possibly be suicidal and to get that person the help that they need. And the class is approved for 2.5 CEUs for social workers, but anyone can take the class. And then the other class that we have is called the ASSIST. It's Applied Suicide Intervention Skills Training. It's a much more intense course. It's a full 2-day course. It's 14 clinical education units for social workers. It teaches all the things that the Safe Talk class teaches, but it also teaches you how to actually do an intervention on someone who is suicidal to save their life. And the classes are taken by social workers. As I said, the CEUs are there, but we have trained the St. Tammany Parish Sheriff's deputies who go out on the mental health calls. We train a lot of MHPs with the school system. We train youth ministers, we train the chaplains at the coroner's office, and most importantly, we train anybody who has an interest to learn about it. If there's a concerned parent, we recommend that they take the course. So it's open to anyone.
So can you go a little bit more in depth on the courses for us and tell us what it is that you might tell people to look for?
Yes. Some of the warning signs are withdrawal, sleeping too much, sleeping too little, giving away your belongings, that kind of thing. And one of the big things that we tell younger people is, if somebody tells you that they are thinking about committing suicide, you need to be direct with them, and you need to not keep it a secret. That's the secret that you don't keep, because you could be saving their life if they're really, really serious about doing this.
So I know that this has been a serious problem in St. Tammany Parish for a while, and I understand it's getting a little bit better. Can you sort of give us a historical perspective of where we were and where we are now?
Yes, typically it's horrific, but about, if I could say an average, between 30 and 35 suicides a year. Last year we had 36. 2 years after Katrina, we had 47 suicides in St. Tammany Parish. And we believe that that was an after effect of the storm, like it's 2 years later and my life isn't any better kind of thing, and people were just in such despair. So it's a serious problem. We're probably about 18% above the state average. And we're just doing everything we can with our prevention education. And the other things that STOPS does, you were asking about the different things that we do. Another thing that we do is we have a support group. It's called SOS, Survivors of Suicide Support Group. So anyone who has lost a loved one to suicide, this support group is designed for them. And we meet twice a month in Mandeville at the First Baptist Church. And it's usually a small group, but it's a great group, and they develop relationships, and they realize that somebody else in the world is going through what they're going through. And it just kind of helps them to work through their grief and go on the journey together. And then another thing that we do is we have something called the LOSS team. It's local outreach to suicide survivors. So every time there's a suicide in the parish, we get contacted by the coroner's office. We work in conjunction with the coroner's office, and 2 of our trained volunteers go out to the scene immediately, and they meet with the family, and then they follow up with the family.
And the 2 trained volunteers, do they have to meet other criteria?
There's a list of things that they need to do to meet the requirements to be on the loss team. One of them is to take that assist training. So, but there are certain requirements, and they're all on our website if anybody's interested. That's our biggest volunteer opportunity, is to be a member of our loss team. That's what we're looking for, that because it takes a really special person, and that there's not that many people who fit that mold to do that particular job. And
you said your website, so can you tell us your website?
Yes, our website is www.stops-la.com, and it has the statistics. You know, we've been tracking the statistics since our existence in 2002. It has our trainings on it. You can register for our trainings. We're having our Safe Talk training on March 6th in Lacombe over at the coroner's office. We're having an assist training on March 22nd and 23rd, and that's going to be in Covington. And those you can get on our website and register for those courses on our website. We also have information about our SOS group, and there are also other SOS groups throughout the state of Louisiana, and we have some information about those because somebody may have a loss and they may have a relative somewhere else who might benefit from an SOS meeting, so we have that. Some video links and some other things that I think people would find helpful.
Right. And so do the trainings cost money?
The trainings are expensive to put on. We have professionals who are trained by an entity called Living Works out of Canada that put on our trainings. The materials are expensive, but we don't want anybody to not take our trainings. We do charge a nominal materials fee, because the materials, the workbooks that we buy and all that, those are expensive. But I would say that anybody who wants to take our courses, they just need to call me, and we can have a scholarship for anybody who doesn't feel like they can put the money out. And it's not expensive. Our Safe Talk right now is $35. Our Assist is $40. Mm-hmm. So, but we would never turn anybody away. We want everybody to take the class.
So you said they should call you. What number would they call you on?
They can call me at 985-237-5506.
Why did you choose to do this work?
I was looking for a job, and I was friends with Lavondra Dobbs, who was the board president at the time, and the administrator had left. And STOPS is very grassroots. It's very small. We have no office. And at the time I had a young child, but I was ready to start getting back to work. And she winded up calling me and said that they had this opening, and I said, okay. And now I'm just so committed to it. I don't want to leave it. It means a lot to me, the relationships that I've made and the families that I've met, and I'm just very proud and humbled to be a part of it.
So you've talked a little bit about volunteers, and you
Yes.
are the only staff,
Right.
Am I correct?
That's correct.
So
we have a board of directors who are volunteers. They are varied. We have some social workers. We have an attorney on our board. Lavondra with VIAlink is on our advisory board. So we have a nice cross-section of the community that are on our board of directors. But we are looking for volunteers, especially for our loss team. So if anybody is interested in that, I would encourage them to go on our website or call me about information on how to become a loss team member.
you do fundraisers.
We do fundraisers. We have September is Suicide Prevention Awareness Month, so we're very busy in September, and we do our signature fundraising event in September. It's called One Step at a Time. It's a 5K out in Abita Springs. So we'll be doing that again this year. I'm pretty sure it's the 15th of September. And we love the event because it's more than raising money, which we certainly need that to put our programs on. It's a great community building event. We have the Boy Scouts come out and present the colors. We have the high school cheerleaders cheering on our runners. Mm-hmm. We have some fitness gurus doing a little warm up. We have Kiwanis, Rotary are involved. So we have a lot of different community members there.
And my husband participated in it last year, and I was there. So my question is, how far did they have to go? I don't remember how far they went.
It's a 5K.
5K.
So
okay.
and it's on the trace. Yes, it's 3.2. It's on the trace, and we also have a 1 mile fun run and you don't have to run. You can walk in case you want to do that. And we usually have the Abita Stomps. They've been with us every year, and so we have some nice music and food, and it's a good event. Every year we add a little different segment to it, and this past year we added a memory bead table. So you would go to the table and you could say, I lost my mother, and they'd give you a green bead, or I lost my friend, and they'd give you a yellow bead, or you could say, I contemplated myself, and they would give you a different color bead. And it kind of got the dialogue going, and it was very popular. Everybody really enjoyed it.
So what do you need from the community for support, besides your volunteers?
Right. You know, support is important, but education is key, and I would encourage as many people as possible to take our trainings, because the prevention is where we want to start. That's the big thing. We do believe that taking care of those left behind is almost as important as the prevention, because once somebody loses someone to suicide, they automatically become at risk themselves. And so we have a lot to keep those who are left behind healthy and in a well state. So that's a big focus of ours as well.
And do you take donations?
We do take donations. You can donate online on our website. If you go to our homepage, and the very bottom of the homepage is a donate button, and you can click on there, and it's a secure PayPal site. You can also mail us a check, and or you can just also call me and I'll come pick it up. We've also recently gotten a few donations. Some people have done a campaign on Facebook, and it's anonymous, and we'll get a check. It won't be gigantic, maybe we got a $200 check, but the really neat thing about it is it's itemized. It's all anonymous, but it's $10, $5, $2, $20, $50. So it's nice to see that so many people are interested in helping out.
So other people can fundraise for you?
Absolutely. I encourage it.
That would be great. So is the Abita September thing the only fundraiser you have, or you have others?
There are a couple of other fundraisers that others put on for us. Okay. We have a golf tournament, and I don't have the new date, Mark Shabane golf tournament in memory of a gentleman named Mark Shabane who took his life. His mother, Jane, has put on a golf tournament for us for the last 3 years. It's an incredible event. It's overwhelming, the support, and it's in memory of him. You can see all the love, and it's just an incredible event. And then the St. Tammany Parish Sheriff's Deputies has also put on a golf tournament. We were one of the recipients. VOA was a recipient, and that's going to be in March. I'm pretty sure it's March 24th. I wish I had my dates. But that's coming up as well.
Okay. Well, I've been delighted to have you. I'm sorry it's such a sad topic, but you bring a lot of light to it in terms of there is a process for people to grieve, and there is help for those people who are left behind, and there is assistance for those people contemplating. So we appreciate what you're doing in the community, Lavondra, and we know you work out of your car.
Pretty much. I'm pretty much always on my phone in my car.
I've seen you
from point
getting
A to
things
point
out
B.
of the back of the car and putting them back in.
Let me mention one more thing that just came to my mind. The North Shore Leadership, which I think is it's the leadership group that's out of Slidell. Their class of 2018 has adopted us, and they are making what they are calling lost love packages. Particularly already this year, there have been a number of children who have been affected by suicide, have lost a parent or a close relative, and they're putting together care packages for us to deliver to the children. So I think it's really good. It might have a journal in it, a little inspiration book, a stress ball, things just to kind of take a little bit of the sting out. And I'm just so grateful to them for reaching out to us and wanting to do that for us.
Okay, and I'm going to end on not a sad note, but a realistic note. We have had a number of suicides already this year. Can you tell us what that is? This is January 30. Is it 30th?
31st.
31st.
Yes, this is horrifying for this year, and I'm hoping that things are going to turn around. I know they will. We've already had 5 suicides this year, which is way high. if you think about per month, there's no way we can have 5 suicides per month. So, and it's particularly unusual because 3 of them were females, and typically suicides are middle-aged males. So, and one was a 96-year-old. It's you know, every case is so heart-wrenching. So we just need to keep pushing on with our prevention programs, keep taking care of those who are left behind.
Well, we admire your spirit and your dedication to this program and
Thank
your
you.
commitment to the community.
Thank you. I will say though, I'm sort of like the face of STOPS, but the real heroes are the ones who are the boots on the ground, our lost team members, our SOS leaders. Those are the ones who really deserve the accolades.
And you'll pass it on to them for
I
us?
absolutely will.
Okay. Well, we've been talking to Lynette Savoy, who is the director of STOPS, and we've been talking about suicide in St. Tammany Parish and the prevention things that people can do to identify people who might be thinking about this and ways to get them assistance before that event. And then we've been talking about people who have lost loved ones and the fact that STOPS can provide assistance and support for them. This is Allison Villars with the Director of Health and Human Services for St. Tammany Parish, and I'll see you next month within the Loop.